about to go broke, and we had to join forces with the hospital. Physicians came and went during those 7 or 8 years period of time. In fact, just in our group alone, there were 34 doctors who came and went just in about a 7-year period of time. By the time it was all said and done, when our group finally joined the hospital in 2004, just shortly thereafter, I was the only internal medicine specialist who was practicing full-time in the Valley at that point. So if you go back to the early 90s, as our group started to fall apart financially, I was very good at economics. I was very good at the business of medicine. I knew how to run a business, knew how to hire and fire, balance books, etc. I understood that part of the business of medicine, but I didn't understand the bigger picture, and that is the policies that got us to where we're at today. And as we started to fall apart, I started to study that and try to understand what is so wrong with our group, or not just our group, but I began to see it was just the whole healthcare system as a whole, not just our group. And as I began to study and to look at state policy and federal policy and going back, if you want to understand our healthcare system, you have to go back 50 or 100 years to see how we evolved into this. You know, there wasn't some mad scientist in the 1940s who devised this horrible system that we have today. It was just a matter of evolutionary process, so to speak. But as I began to study that and to try and assimilate what it was that was going on, I began to see some very disturbing trends. The part of the reasons that we got to where we're at today are multiple. There's not just one, this is what happened. And as I started to weave that together, I began to say, gee, many Christmas, this thing is really screwed up, and now I'm beginning to understand the healthcare system very well, not just our group, but as a whole. And then I began to ask myself, what are we going to have to do to fix it? And so obviously single payer was not even something that I would have even considered 10 years ago. In fact, 10 years ago I didn't even know the word single payer existed. And so as I started to look at that, and I looked at different ways that we could fix this whole thing, I mean, you talk about subsidies, expanding Medicaid, all of that, I began to realize that the only way that we're going to fix this system is we're going to have to put everyone on a Medicare-like system. In order to truly fix the system, we're going to have to put everyone into one single risk pool. We're going to have to share that risk, and the most efficient way to do that is through the tax system. At that time, I didn't know anything about Physicians for a National Health Program. I had never heard of Bob Lebeau. In fact, the word single payer, I hadn't even heard that, you know, back in the late 90s. And so as I started to put all this together, I said, you know, I'm going to write a book about this. This is so important to do this. And so one day I was down at the emergency room, and one of my colleagues, who's sort of an old hippie from the 60s, very liberal individual, she knew how conservative I was because at that time I was still a Republican, and I was very sheepish about the whole thing. I mean, here I am, a Republican, thinking about nationalizing health care. It just went against the grain of everything that I stood for. But you have to remember something, Amy. I didn't come to those conclusions with lofty ideals of social justice. It was purely from an economic standpoint. This is the only way that we're going to be able to fix this and do it efficiently. So as I started to talk to Beth, she said, Rocky, have you ever heard of a group called Physicians for a National Health Program? And I said, no. And so she gave me the web page, and I got on, and as I started looking at, reading the information that had been written by Steffi Woolhandler and Dave Himmelstein, I think you've talked to them before, looking at Bob's book and things, I thought, criminelli, these people are thinking like I'm thinking. This is, you know, I thought I was this crazy person out in the middle of nowhere coming up with this idea. And so that spring there was a conference in Chicago that Ida Hellener was putting on with training people to be advocates for single payer. And so when I went out there, she introduced me to this book, Healthcare Meltdown, that was written by Bob Lebeau. And as I started going through it, it was sort of one of those Twilight Zone experiences, I guess, because it was really strange, because he had written my book. he had, I mean, even the chapters were very similar. And so, and I guess it's not surprising, because when you start coming to these conclusions, you start thinking in the same lines. So I thought, you know, I'm not going to write my book. Bob LeBeau already did this. I'm just going to get out there and start being an advocate and start speaking.
And Bob LeBeau was president of Physicians for a National Health Program. Ultimately was paralyzed in a cycling accident and died about 5 years ago.
Yeah, that's correct.
So you wrote the introduction to the new edition of Healthcare Meltdown, Confronting the Myths and Fixing Our Failing System. Yeah,
because that's what's so strange about that, is because I was up speaking in Idaho and got to meet his wife. And to make a long story short, Ida got a hold of Mrs. LeBeau, Gail, and the two of them said, you know, we'd really like to have Rocky write this, because my background is so similar to Bob's. In fact, Bob was a Republican and changed to a Democrat at about the same age that I did that. And Bob practiced rural medicine. He practiced to the underserved areas. He was very passionate about the uninsured, very similar to myself. And so it was quite an honor when they called me and said, would you revise this and update this for the second edition? And so I did. I put an introduction in there. I updated all the numbers, brought it all up to date, and then added 2 chapters to the book.
When you hear, for example, Barack Obama and Hillary Clinton debating health care, what are your thoughts? And explain what single payer is.
Well, single payer can be a lot of things, but basically what single payer means is that you have one organization that handles the financing of health care. That one organization could be a for-profit insurance company if you only had one. It could be the government. It could be a public utility commission. So that's all single payer means. The thing is, you know, you and I grew up in the same era. We have this idea about single payer and socialized medicine sort of locked together. When I say the word single payer, the first thing that comes into people's minds is, oh my God, social medicine, we get socialized medicine, and the next thing that's going to happen is that the hammer and sickle is going to start flying from the top of the Capitol. And so when I explain to people that there are a lot of different types of single-payer systems, you can have purely socialized medicine. That's kind of like what England has. The government owns the hospitals, the government owns the clinics, the government finances all the health care, and all the doctors work for the government. That is truly socialized.